talking, questioning, sharing your experience, information, education, entertainment, news, instructions, advice on diabetes, high blood pressure, strokes, menopause, AIDS, pregnancy, sex.
Sex? Did you say sex?
As prescribed, take your medication, exercise, and diet. On 88.5 Super FM, tell a friend, call your neighbor. Casualty 911 is on.
Hey, 4 minutes after the hour of 10 a.m. This is where we say good morning, good morning, good morning. Inside this What Monday. But again, beautiful, eh? Sometimes, it can't always be sunny. More grass for the cows to eat. You understand? Farmers, they too need that blessing. So the crops, can grow real nice, and of course for them to cultivate. Hey, if it's between the hours of 10 o'clock and of course 11 a.m., Casualty 911 is on a Monday. All right? So, here's your presenter, Miss Wilson. She's here along with Fawn. So let me say good morning to both of you ladies. I think that you guys had a wonderful, wonderful weekend. Good morning.
Morning, Ulan.
Good morning.
Morning, Fawn.
Fawn, can you hear us? I think, can you hear us? Show us
Yes, I can hear you.
Sign. Thumbs up. Can you hear us? All right, but we cannot hear you. Okay, can you hear us now?
Yes, I can.
That is it.
Wonderful. It's nice hearing your voice, Fawn.
Any echoes?
Not yet, Elan, so I hope we will not be going down that road today.
Well, they won't have any. If it's not yet, Pagadebusa. Welcome, guys.
Thank you, Ulan.
Mm-hmm.
So let me just say, I cannot say a warm, but it's really, really cold out there, raining.
That's why I turned off the AC on this.
Thank God, Ulan, because I brought my jacket. Yeah. I knew it would have been cold. It has been cold from morning.
From yesterday?
Yeah. So I know persons out there, it's it's raining out there. So I want persons to take the necessary precaution. Make sure you walk with your umbrellas, wear proper shoes to prevent slippage or any accidents. Drivers, do take caution on the road.
Oh, Sherilyn is as well.
Oh, morning, nurse.
Hi, morning.
All right. So drivers, just be careful on the road. Ensure that you take the necessary precautions, especially with your passengers or persons with their own personal vehicles. Let me just say, happy month all our listeners from M&C Drugs, market vendors, our sanitary workers, our teachers, principals, students, those persons that are out, students that are at home, that are on rotation, and our firefighters, I know them, workers and police officers. So I just want to say a warm good morning to everyone out there. This morning, we have our guest, but Fawn will be introducing the guest. And I would like to say, Fawny, I'm so happy that you're here with me today. So without any further ado, let me let Fawn speak to our people this morning.
Good morning to all our listeners. It's a pleasure to be back as usual. Today, we are going to have a nice little chat with our nurse, Nurse Duncan. She's not a stranger to our program, but before she gets into the meat of the matter, I'll make a small introduction in terms of our topic of discussion this morning. In January, we observed cervical cancer awareness. As we know, cancer is a condition that affects many people, and a cancer gets its name based on what part of the body it starts or it originates. So cervical cancer is a cancer of the cervix. So because we say cervix, that should let all of us know that it is a cancer that only affects women because only women have a cervix. It's part of the female reproductive system. So the cervix is actually just a very small part that joins the womb to the vagina. This cancer is one that affects quite a few people. And today, nurse will be focusing on prevention and early detection. And we can speak about prevention for a number of reasons, which I'm sure nurse will go into, because this cancer is not quite along the same lines. I'm trying to be mysterious because I don't want to say too much before nurse comes on. Okay, so just a few basic stats from 2014 to 2018 in St. Lucia as it relates to cervical cancer. We have had between those years 22 point, the rate has been about 22.8 persons per 100,000. It's one of the top 5 cancers diagnosed, and while it affects all age groups of women, sometimes we think that cancers only affect older people. The age group during that period which was most affected was age group 25 to 49, followed by 15 to 24. So it means that irrespective of your age as a woman or as as an adolescent, you can be affected by cervical cancer. So in terms of prevention and early detection this morning, we have with us Nurse Duncan, who is a family nurse practitioner. She has been with us a few years ago. I think that was the last time she was with us. And she will be speaking to us about the HPV vaccine. The HPV vaccine is one of the tools that we have, and we have it because HPV means human papilloma virus, and the cervical cancer is caused mainly by certain types of human papilloma virus. I'm sure nurse will go a little bit more into that. So she'll be speaking about the HPV vaccine, what it is, who can get it, who is it administered to, why is it being administered to that group of people. We'll go into screening, which is the Pap smear. Last week, Louisa mentioned some of the checks that we need to be doing regularly, some of them annually, and the Pap smear is one of them. And that is doing the Pap smear is important in terms of detecting cervical cancer. So nurse will be going into that. Who should get screened, the do's and don'ts, what you should be doing before you go for your pap smear, what you should not be doing, and so on. Why some people choose not to do the pap smear, and reasons why you should think very seriously about doing it. We will also be talking about where you can get your pap smear done within the public health system. Remember that when you want to do any of those screenings, you can choose to do them either publicly or privately. But we tend to focus on the public health system because we work within the public health system. So, Nurse Duncan, thank you for being with us. It's a pleasure to have you. Please feel free to commence with our discussion this morning.
Okay, good morning, everybody. I'm so excited to be here this morning. Sometime in 2020, we had the same show, and I was the one here. So I'm no stranger to Super FM and the Super people, the people of Swazel, the people who love to hear about what is it that we have in store for them when it comes to health. Good morning to everyone. This morning, as you know, we'll be talking a little about cervical cancer in terms of prevention. Now, cervical cancer is celebrated around the world in the month of January. So most of the time we'll come to you around this time to let you know that the year has started. So start to get your resolutions in order, which means that you need to put down that this year I am going to check on my cervix. This year my child is going to get his or her vaccine to prevent from cervical cancer. So don't forget to put these on your New Year's resolution because it is important for you to consider your health as a new change for you for the new year. Now, this morning, I just want to touch base on a few things. I don't want to bombard you with too much information, but
Nurse Duncan, your mic is muted. Nurse Duncan, we're not hearing you. All right. I'm hearing now, but your mic was muted.
Yes, maybe I touched something I was not supposed to touch. Sorry. Yes.
Yeah.
Okay. Sorry about that. All right, so let's move right along into the presentation. Okay, so the first thing I want to tell you about this morning is about HPV. Now, as Fawn rightly said this morning, HPV stands for human papilloma virus. Now, for the shortened part of it, we just say HPV because not everybody will remember to say human papilloma virus. So we just say HPV. Now, this virus is a very common group of viruses. Most people will get some type of the HPV virus at some point in their life, and they may not know it. The reason for that is because most of the time we can get rid of it on our own, provided our immune system is strong enough to fight against it. But how do you know that your immune system is strong enough to fight against it? You don't know. So basically, this virus is associated with cervical cancer, with genital warts, and so many other viruses. But today we are going to be focusing on cervical cancer caused by HPV. HPV, there are over 100 different types. So I won't even spend time going into all the different types because that might not be relevant for you right now. But I just want to let you know how the HPV virus can be spread. Okay? So HPV can infect the mouth, the throat, the genital area, and the anal area. All right? And that means it's very easy to catch the HPV virus. And you don't even need to have penetrative sex to get this virus, because if you focus and you think about all the different types of sexual activities that we take part in, then you will understand that it is not only through the vagina that you can get HPV. You can get HPV through your mouth, through your throat. And so those persons who engage in oral sex and the person is infected, then they too can catch this virus through that means. All right? Now, any skin-to-skin contact of the genital area can spread the virus to you. Okay? So, if it is that you put your mouth on the penis, then you can get the virus. Even if you use a condom when you have sex, the fact that your other areas of your body is being exposed, then it means that you can get the virus. All right, you can get it through your vagina, through your anus, and like I said, through oral means. Also, something that is very common these days is sex toys. And if this object that the person used is infected or it's contaminated with the virus and it is not properly washed or disinfected, then when the person uses it again, they can infect themselves with the sex toys. Or if persons are having orgies and they're sharing sex toys, so one person is using it and they're just paying no mind and sharing it along their process, they too can get infected if one of the partners who is part of the orgy is infected. Now, it is important for you to know that you do not have to have sexual contact with a lot of people to get HPV. In the past, persons used to think that it's promiscuous persons who were getting HPV. But you can get HPV the very first time that you have sex with somebody who has had sex before. So if you are female and you're having sex with a male who has had partners before, and the thing about HPV, it's not just washed off your penis or your private part. Once it has infected the area, it stays there. And for years, a man can be carrying HPV on his penis, and you, as the woman having sex with him for the first time, you can get infected. So it does not mean that you have to be a promiscuous person or prostitute, as usually thought, that that's how you get HPV. Any sexual contact with somebody who is infected already, you can get HPV. Okay? So far, are you still with me? I'm hoping that I have not bored you out, but this is very important information for you to know, because this used to be a very important myth that they used to spread around the place, that only persons who are promiscuous are the ones who can get HPV. Now, the cancers that are linked with HPV include cervical cancer, anal cancer, cancer of the penis, cancer of the vulva, cancer of the vaginal area, and some cancers of the head and the neck. So if you realize I mentioned cancer of the penis, so it means that this HPV virus don't only affect the cervix, but it can affect the penis of the man. So the men out there, if you're hearing me, it's important that you encourage your wife or your girlfriend to go for a Pap Smear to detect whether there is any HPV on her cervix. Now, you as a man need to remember that you too have to take your precautions. So in as much as we do not have, we cannot do a Pap Smear for a man, but it is important that you protect yourself at all times so that you do not infect your partner. How do you protect against HPV? You cannot fully protect yourself, but there are a few things that you can do that can help. Condoms per se can help you. But what I said earlier on is that remember that the condom only covers the skin of only the penis, but the areas around the penis are not covered. So remember I mentioned that any contact with the genital area, once that area has already been infected, then it can be spread to somebody else. However, there is good news, especially for our young children, those that we love the most, the ones that we say they are the cream of the crop. There is hope for them. All right, in St. Lucia, we have now introduced the Hpv vaccine. Now, it has been around for a very long time, but St. Lucia got on a bit late, but better late than never, they say. So sometime in 2018, we introduced the Hpv vaccine together with our other school vaccines. Okay, so when your child got to grade 6, there was a vaccine that was introduced together with the tetanus vaccine and the MMR and the polio vaccine that our grade 6 students were getting. we introduced the HPV vaccine, and since then we have been using it every year for our students in grade 6, provided that their parents give permission. Now, I said that to indicate to you that we don't just give your children vaccines without letting you know or informing you, but we just encourage you to make the right decision to protect your child for the long run. So, HPV vaccine, it helps to protect against the same cancer that I mentioned earlier on. Cervical cancer, some of the mouth and the throat, cancer of the anus and the genital area, like the penis for the boys. And it also protects against genital warts. Okay? Now, in terms of this vaccine, you have to understand that every vaccine has a time when it is at its peak for being effective. So the reason why we are introducing it at the ages 11, 12, around that age there, it is because it is most effective in protecting against cervical cancer or penile cancer or anal cancer at that age. It's not to say that persons older cannot get the vaccine, but it's more effective around this age group. So the first dose is given at around 11, 12 years old, although it can be given as early as 9 years old. But in St. Lucia, we have decided that we will give it along with the school vaccines, and we will give it to students who are around 11, 12 years old. Now, this vaccine is given either in a 2-dose form or a 3-dose form, depending on the age that you have taken the vaccine. So for those who take the vaccine or who got the vaccine around 11, 12 years old, they get 2 doses of the vaccine. So any child under 15 who takes this vaccine, they will get 2 doses of this vaccine at least 6 months apart. So they will take their first dose when they are in grade 6, and when they probably get to Form 1 or maybe Form 2, they will get the second dose of the vaccine. But for those children who end up getting the vaccine after the age of 15, so from 15 years and up, they will need 3 doses of the vaccine. As I mentioned earlier on, that once it is taken before the age of 15, between the ages of 9 to 15 or 14, it is more effective. So they will only need 2 doses. But for those of us who are older than that age, we will need 3 doses of the same vaccine for it to be effective in protecting against HPV. Okay? Now, this, as I said, this vaccine has been around for a very long time. So it's nothing new. It's just that we came on board late, and persons are asking why we never had it before and so forth. But as you know, everything is politically related and what we could have afforded, because it's a very expensive vaccine. As we all know, that even if it's given for free in our public system, it doesn't mean that somebody didn't pay for it. Now, if we have to allow parents to pay for that vaccine, we will get maybe about 20 persons on coming for the vaccine because it's expensive. But because we want to make it equal, we want everybody to have an equal chance of being protected, the vaccine is for free at every healthcare facility in St. Lucia. That is our public health centers. Now, there are doctors who give it privately, but it comes with a fee. So I will encourage every single mother or father or guardian or parent to make the right decision for your child today and to allow your child to get the HPV vaccine. If you're hearing it for the first time, from today, from 8 o'clock until 4:30, every single health center is open today. You can call your nurse and she can give you more information about the vaccine and so forth. Now, I just want to share with you some important statistics about the vaccine. The vaccine protects against 9 HPV types, which cause around 90% of cervical cancer in women or in girls. You hear that? You see how effective the vaccine is? 90% of the cancers of cervical cancer is prevented because of taking the HPV vaccine. And 95% of all HPV related cancers in men and 90% of genital warts. So you realize how effective this vaccine is. I'm talking about 20%, 10%, or maybe 50%. We're all the way in the 90s. So that's to show you how effective this vaccine is protecting against cervical cancer, against penile cancer in the boys, and genital warts. Okay? Now, does the HPV vaccine offer any benefits to you if you are already sexually active? Now, I know some people might be saying if we give the children the vaccine, they'll want to go and have sex earlier on. I have come across so many studies discussing that issue, and they're saying that it does not increase the likelihood of a child having sex because they take the vaccine. Okay, so for those mothers who are out there who are afraid and saying that, oh, that will encourage the children to go and have sex early and so forth if they take the vaccine because they know they'll be protected. But no, it is how you raise your child, how you inculcate in them what is important to them at the stage of life that they're at, that education is more important than having sex right now. There's enough time in the world for sex. These are the things that will influence your child in the right direction, not HPV vaccine, okay? Now, does the HPV vaccine offer benefits if you are already sexually active? Yes. Remember I said that the vaccine protects against 9 types of the virus. So if it is that you already sexually active and you have one of the strains that causes HPV, the other strains that causes HPV, the vaccine will still protect you from getting a further infection or an added infection. All right. So the vaccine protects you only from specific strains. Okay. Now, usually they're saying that there are over 100 strains, but the most important one that they're focusing on is strain 16 and 18. So these are the strains that the vaccine is geared towards. However, it is important that you take all your precaution as a mother, as a father, as a woman, as a man. Now you will ask me, is this vaccine safe? Because these days we are talking a lot about corona vaccine and persons are, skeptical about taking it. But like I mentioned to you that this vaccine is not new. This vaccine has been around for a very long time, and it has been proven to be safe in many of the studies that have been done. Overall, the symptoms are mild. After the child takes the vaccine, or anybody who takes the vaccine, they can experience some soreness in the area like everything else, a little swelling at the injection site, and some redness. So we encourage you to not use these excuses to not allow your child to take the vaccine, because some children may have soreness, some may not have, some may have swelling, some may not have. But in the event that the child gets swelling in the area or redness, all you do is to put a cold compress on the area and to just keep monitoring the site. If you realize it's getting worse, then contact your nearest healthcare provider. But most of the times, it is just mild and it goes away in a few days. However, some persons have reported a little dizziness after taking the injection. Now, we don't know if it's because of fear or any other reason that they fainted or they were dizzy, but we encourage, after taking the vaccine, we always allow the student or the child to be seated during the administration, and they remain seated for a little while, as long as about 15 minutes before they can stand up. All right. So that's one of the ways that we can prevent the dizziness and the fainting. So as soon as the child takes the vaccine, we do not allow them to just stand right away and to walk away. We allow them to sit for a little while. We ask them, how are you feeling? Are you feeling okay? Are you feeling any dizziness? Are you feeling faintish? We always check on them before they get up, because it's important that we do our checks as well. So as health care providers, since we're already aware of that, we always take our precaution, and we also ask you to look out for these precautions as well. All right, so it's important for you to not allow that to deter you from allowing your child to get the vaccine, because taking the vaccine outweighs all of these. Yes.
Just before you move on, Just for those parents who may want to do a little extra research, is it possible to share the name of the HPV vaccine that is used in St. Lucia?
Okay, in St. Lucia, we have the Gardasil 9. Okay, so basically that's what we have. And that one protects both boys and girls from the HPV virus. So you will tell yourself that why the boys have to get it too. But remember, I mentioned that the boys can get penile cancer, they can get anal cancer, and we live in a world where people's sexual orientation is their business, and you do not know who is engaging in anal sex, or both using both ends. And some of our children are already at a place where they can be molested, and we do not know. Some of our parents, we leave them with people that we trust, only to find out that our children are being sexually abused. So I will encourage every mother to do your homework, find out your business, but the most important thing is to protect your child.
Thank you, nurse.
Yes. So how is the vaccine administered? Now, as everything else, almost all of vaccines that we give in St. Lucia, if not all, we only give 0.5 mils of the vaccine. So it's not a lot. It's a little bit of the vaccine and it's very effective against HPV virus. So we give 0.5 mils of the HPV vaccine in the muscle of the arm. Okay, it can be left or right, depending on which arm the nurse used for the other vaccines. Because remember, I mentioned that it's given in conjunction with other vaccines on that same day, the polio vaccine, the tetanus vaccine, the MMR vaccine might be given on that same day. So the nurse will depend on which arm she used for the other vaccines. Then she will determine which arm she will use for the HPV vaccine. And it's the preferred site. The arm is the preferred site, although it can be given on the thigh, but we prefer to use the arm because that way we can monitor the area and to see the redness, if there is any swelling, and it's very easy for you to detect any changes that the person might be experiencing after getting the vaccine. Now, the whole reason why we're giving this vaccine is for protection. All right? We want to protect your child or protect you if you choose to take the vaccine against cervical cancer, against mouth and throat cancers, against anal and penile cancers. I'm repeating this again because I want you to get it that the number of cancers that the HPV vaccine can protect from is not just cervical cancer. In as much our focus is cervical cancer, but I just want to let you know the benefit outweighs the risks. All right? Now, for those of us who choose to take the vaccine at an older age, or right now, between the ages of 9 to 45, it is important that you know that you will be getting 3 doses of this vaccine in order for it to be effective if you are older than 15. All right, so you will end up getting 3 pricks as opposed to 2 pricks, because you want to ensure that even if you're taking a vaccine, you want to ensure that it's effective against what you're taking it against. And it has been researched over and over, and this is why they're coming up with these recommendations that taking the vaccine is protecting you against these particular cancers, particularly cervical cancer in women, and we will need 3 doses for it to be effective. Now, you will ask me that if you take the vaccine, do you still have to do a Pap Smear? The answer is yes, yes, yes. Okay? Because even if you take the vaccine, how will you know that you do not have HPV or you do not have cancer? You cannot just know that off your head. It will be important that you would do a particular test that is going to detect whether you have the virus, which we call the HPV test, or the Pap Smear, which is we test for that same test, the same virus, but all we're looking for is that whether there are any changes to the cervix. All right? Now, for those of you who have had a Pap Smear done, every woman has a different experience when they have a Pap smear done. But that should never deter you from having a Pap smear. All right? It's important that all women begin at the age of 21. Once you are sexually active, you need to do a Pap smear. It's also important that those of you who have not done a Pap smear, if you notice any signs that is coming through your body, such as vaginal bleeding after sex, bleeding between periods or after menopause, pain under your belly or in your pelvic area, pain during sex, it is important that you contact your nearest healthcare provider. It may mean that you have already been infected and your cervix is already showing changes and it's almost advanced. However, our focus today is not on those cases that have been already been advanced. We are focusing on prevention. So it is important that all women from ages 21 and up that you have a Pap smear done. Now, for those of you who have had a Pap smear before, how often should you repeat a Pap smear? So generally, with new recommendations, things are changing. They're recommending that a Pap smear be done every 3 years for women 21 to 65 years old, once that woman has had 3 consecutive normal Pap smears. So if you had a Pap smear 3 years ago and all 3 Pap smears were normal, they're encouraging you that the next time you should have a Pap smear is in 3 years' time. Okay? So I just want to make that clear for those who have had 3 consecutive normal Pap smears. But knowing our women and our people, not many women have had 3 consecutive Pap smears done. Sometimes they miss last year or they miss the year before. So it's very rare you'll find a woman that has had 3 consecutive Pap smears done, unless if you have those women who are very conscious about their health and they always have their checkups and they have their doctors sending their reminders that you missed a Pap smear last year, so you need to come for your Pap smear. So it means that almost all our women in St. Lucia need to do their Pap smear almost every year, because not many women have had 3 consecutive Pap smears. A few have, but not many have followed through on having their 3 consecutive Pap smears. So for those who have had their 3 consecutive Pap smears and it has been normal, the recommendation is that you can have another Pap smear than in the next, in at least another 3 years. However, women who are 30 and older, every 5 years, you can have an HPV test. All right, it's the same procedure as doing a Pap smear, but they will just be testing to see if you have the virus on your cervix. Okay? The Pap smear, we will remove some cells from your cervix, but with the HPV test, we will be testing for the virus. Now, I know Dr. Louise is one of the private doctors that does the HPV test. So if you need to do one, or if you're interested in having an HPV test done, you can contact Dr. Louise's office. She didn't pay me for that advertisement, but I'm just letting you know, because in my own experience, that's who I go to for my test. And she does this HPV test, and it's not free, but it's important that you have this test done if you so desire. Okay?
Somebody's asking this question. How soon after they conceive a child, they give birth to a child, should they get a Pap smear done?
Okay, you said conceive. Conceive means that the person got pregnant.
Right. So they after giving birth.
Okay, so after giving birth, that's what you want to ask.
I corrected myself, yes.
All right. Okay, so generally, when a woman gets pregnant, part of the first set of screenings that we do for her when she gets pregnant is a Pap smear. So when she comes and we do the full physical examination where we check her from head to toe, part of the examination includes doing a Pap smear. The only time we will not do a Pap smear is if the woman complained that she experienced some bleeding when she got pregnant or she has had miscarriages before. We avoid having a Pap smear then at this stage. So generally, most pregnant women would have had a Pap smear done in their pregnancy. However, if that is not done in the pregnancy, when the woman comes back to us at 6 weeks after she's given birth, we do a pap smear for her at this point because we have to take a look at the cervix to see if the cervix has gone back to its normal shape and its form and there's no redness. And at the same time, we do a pap smear for her at this point in time. Okay, so is that answered? Am I clear?
Yeah, she heard you.
Yes. So if you had a baby and you were already 6 weeks or 8 weeks or 10 weeks or 3 months, it's a good time to have a pap smear done. Anytime before that, we do not interfere in the cervix before 6 weeks. We take a look at it sometimes, depends on, but we generally wait until 6 weeks when the womb has now gone into place and the cervix now has shown some healing and it should be back in its normal color, shape, and form. That is when we do a pap smear for you. Now,
okay.
Yes. Now, I mentioned earlier on about women who can do a pap smear every 3 years once they have had 3 consecutive normal pap smears in the last 3 years. However, there are some exceptions to the rule. So persons who are at very high risk of cervical cancer, there are different recommendations for you. So if it is that in the past your pap smear was abnormal, they discovered some abnormal cells or they discovered you had HPV, it's important that you have a pap smear done every 6 months to a year. Okay, now that will determine on how often your doctor wants to see you, because at this point you would have been under medical supervision because you already had been exposed and you were infected. So your doctor will tell you, I want to see you in the next 6 months, or you know what, let's wait a year and we'll repeat the pap smear. Also, women who are already immunocompromised. So women who are HIV infected, you need to do a pap smear more often than the 3 years. So you have to do it every 6 months to a year. All right, that also depends on how often your doctor wants to see you, but at least every year is the recommendation. Persons with a weakened immune system already, so persons who had an organ transplant, persons who are going through chemotherapy, persons who are on chronic corticosteroid use, so you are on steroid use, and so your immune system would have been weakened as a result of taking steroids. Women who are infected with diabetes mellitus. As we know, diabetes is one of the conditions that puts you at a place where you can get infections very easily because of the inflammation that it causes generally around the body. And the cervix is part of your body, so you can experience a lot of inflammation and changes to your cervix at this point. So our diabetics and who are listening to me, I would encourage you to have your pap smear done every single year, because your body is in a place where you are already going through some changes in terms of inflammation, and the cervix can have a lot of inflammation, especially if you have diabetes. And at this point in time, we want to encourage every single diabetic who is hearing my voice to make an appointment with your nearest health center to have a pap smear done. Okay? Now, in terms of diabetes, there are other infections that you can get that the pap smear can also detect. So people with diabetes at high risk for getting yeast infections. And so the pap smear, in as much as we trying to detect cancerous cells, it also picks up things like yeast infection and bacterial vaginosis that we see very often among our diabetics and persons who have HIV and persons who are immunocompromised. So I'm encouraging you at this point, if you're hearing me or if you know somebody who have diabetes, encourage them to have a pap smear done as well. All right, persons who have a history of smoking. So women who smoke, you are putting your body at high risk for getting HPV, because smoking, it causes a number of changes to the cells in your body, the nicotine in there and all of those other ingredients that they put in the cigarette, they put your body at risk for getting weak. And so because of that, we are encouraging those women who smoke to stop smoking, first of all. And those of you who have a hard time leaving the smoking, please have your pap smears done every year, because the cigarette smoke is already causing changes to your body and it's causing changes to your cervix. Okay?
Fawn?
All right. So
maybe now we can speak a little bit about how they should prepare for the Pap smear.
okay, very
What it
well.
is they should and should not do prior to going in for the Pap smear.
Okay. So prior to going in for the pap smear, it is important that you avoid certain practices. All right? Before coming for the pap smear, please do not take a douche. I know there are still women who are still practicing douching, and you figure if you douche, you will wash the virus out of your cervix, and then this will not find any virus or any cancerous cells on your cervix. But what you don't realize is that douching puts your cervix and your vagina at risk for getting other infections, because you can be washing out all the normal bacteria that the vagina has to protect it from getting yeast infection. Okay, so it's important that you do not douche. Okay, don't put any vinegar in any water and squirt it up into your vagina, or take a rag and go all the way in, say that you're cleaning your vagina before the pap smear. There's no need for this. All you need to do is just wash your vagina with normal, mild soap and just present yourself to the clinic. There is no need to do any douching. Also, we would encourage you, we cannot tell you when to have sex, but since you come in for a pap smear, we encourage you to avoid sex at least a day or two before coming for a pap smear. The reason for that is because when you have sex, sometimes all the sperm doesn't come out on the same day. And so what happens is that when we're doing the pap smear, we can pick up some sperm on the slide, and it can interfere with our test results. So it's important that you avoid sex, or maybe unprotected sex without a condom, so that when the man ejaculates into your vagina, that the sperm doesn't remain there, and then when the results come back, the results tells us that there is spermatozoa on the test, on the slide. Okay, so these are the two most important things that you must avoid. And the only thing you just have to do is to wash your vagina with just mild soap. These days have so many vaginal washes around the place. They are mild and they have been dermatologically tested. And so just go to your supermarket, nearest supermarket, or your drugstore. You'll find them on the shelf. Just normal mild soap, simple soap can be used as well, because these have no scent and they will not cause any further risk for infection down there. So ladies, if you're hearing me, please stop douching. Even if you're not coming for a pap smear, douching is not a good practice for women to partake in, because it changes the normal bacteria that is supposed to be there to protect you from getting yeast infection. So please stay away from douching.
Okay.
Does that answer the question?
Yes. So there's another thing. You mentioned earlier that there are many women who don't get their pap smear done, that it's very rare that you would find a woman who has had a pap smear 3 years consecutively.
In a
And
row.
many times it's because people have certain people have certain ideas of what the preconceived ideas, thank you, of what the pap smear is like. Some people speak about it being so painful and so on. So could you just speak a little bit on that? What can they expect? What would make the experience a little more comfortable and so on?
Okay, so there are a number of barriers that we have noticed in our practice that women have expressed why they don't come for a pap smear. They may not be all legitimate, but we accept them for what they are. So some of the barriers that we have experienced that we ask a woman, why haven't you come for a pap smear? I don't really know what a pap smear is. What is a pap smear? So we find that lack of knowledge or their awareness, they have not come for a pap smear because they are not aware how important a pap smear is, or they don't really care for it too much, so they don't really research about it. So lack of knowledge can be a deterrent. We also have women who have, like you said, preconceived ideas and negative perceptions of the test. Although some women can tell you that they've had a pap smear before, it was very painful. However, it is not supposed to be painful. I'm saying that with confidence that a pap smear is not supposed to be painful. If a pap smear is painful, this is provider dependent. So if you have a nurse that is rough, then you will have a lot of pain. Or if it is that you already have an infection like yeast infection, when the pap smear speculum goes up there, you would experience more pain than is expected. So naturally, a pap smear is not supposed to be painful. A pap smear is supposed to be a little uncomfortable because, come on, you're pushing a device into somebody's vagina. And I'm pleased to say that the persons who created the pap smear speculum, they designed it in a way that it's almost shaped like a penis. So the end is rounded and smooth, just like a penis. So it should be able to enter smoothly into the vagina, just like the penis would enter smoothly into the vagina. So for those of you who are afraid to come for a pap smear because you figure it's going to be painful or it was painful before, maybe you should change your provider. Maybe the provider was a bit too rough. But do not let fear prevent you from coming for your pap smear because it's just a few seconds. As quickly as we go in, as quickly as we come out. I've had patients that, you put them, you encourage them to come for the pap smear. When they come, when you're done, you're like, nurse, you finished already? Yes, I'm done. But I didn't even feel that. Yes, because it is important for the woman to be prepared for the pap smear. So when you come to your health center for your pap smear, your nurse is going to prepare you for the pap smear. She's going to run you through the process and tell you, okay, what happens first, second, last, and she will encourage you, to relax because the more tense you are, the more painful it's going to be. So if you hold in your waist very tight or your legs, you grip it into the bed very tightly, you find that you're going to allow the vaginal muscles to contract. And so when that nurse is going in there, you are going to experience pain because the muscles are pushing against the speculum, and so it is going to cause a lot of pain. So it's better for you to come with an open mind and listen to the nurse when she asks you to take a deep breath in, to relax, to think of something nice, something positive to relax you. And it makes it easier for the speculum to go into the vagina so that you will experience as little as no pain as possible. Now, it's also important that families provide support for each other. Now, this is a way that it facilitates you coming for the pap smear. Because if I, as a mother, I always come for my pap smear, I want to see my daughters be in good health, I will encourage them to go for their pap smear as well. So it has to be a family culture where persons encourage their brother, not their brother, their sisters, their aunties, their cousins, their mothers, all the people you love in your life who are females, encourage them to go for a pap smear. Because when there is support, persons tend to go for a pap smear more often or more frequent. Now, also what we have realized is that if society don't really put any value on doing a pap smear, persons will not go for a pap smear. So all across the board, we're encouraging persons, even if you're not a nurse, even if you're not a doctor, but encourage your friends to go for a pap smear. A few girlfriends, we want to go for a spa day tomorrow. Let's plan for a spa day. But let's also plan to go to the health center or our doctors for our pap smears together as well. So you can form supportive groups among yourselves. And if you already have girlfriends, you all can put a day down in your calendar. That's our day for us to go and do our pap smear, all of us. So we're realizing that the more support that you have to go and do a pap smear, the easier it is for you to go and have a pap smear done. The same way you're planning for a spa day, plan for a pap smear day for yourself and your girlfriends and your sisters and your mothers and your family members who are female. All right? Now, some persons will tell me they don't have money to go for the Pap smear. Now, in the past, I would encourage you to come for a Pap smear and we would send the results to, at the time it was VH or OKU. But we realized the results were taking so long to come back because you know what? VH had to process all of these Pap smears for everybody around St. Lucia, and it was taking a lot of time for the results to come back. So now we have a number of private labs in St. Lucia who do the test for us for only $20. So you come, we do the test for you for free in the health center. And we also ask you for a small fee of $20 to take it to the lab on your behalf. Or if you so desire, you can come back for your slide and you can take it to the lab yourself. All right. All these are ways we use to encourage you to come to the Pap smear. So we just let you, it's a just small fee of $20 just for processing the Pap smear, and you get your results as soon as 2 to 3 weeks. All right, depending on how many Pap smears that private lab have to do, it usually comes back within 2 to 3 weeks. All right, so it no longer takes that amount of sometimes a whole year you send a Pap smear and the results are not coming back. But right now we have found other alternatives because we want you to be safe. We want to protect you at all costs. So we find other means so that you can come to us and you can have your Pap smear done. All right. So I encourage every woman in the hearing of my voice, build a relationship with your nurse. The closer you are to your nurse in terms of your health care, the more relaxed, the more comfortable you are so that you can go to her for a Pap smear. All right. If you have a good rapport with your nurse, the chances are when you come, you will not be tense, you will be relaxed. And even if you tense, you will trust her voice to tell you, okay, relax, take a deep breath. You will trust her because you already have that relationship with her. So your nurse is supposed to be somebody that is supposed to be your confidant. You're supposed to be able to keep your business in confidence. So if you come for a Pap smear, there's no way that the nurse is supposed to be telling your mother that, oh, you're not talking for a Pap smear yesterday. You know, that's not for the nurse to tell your mother or your friend or your cousin or your neighbor. That is your business to share. So we have a number of nurses in our healthcare facilities around St. Lucia who are confidential. Now you will tell me, oh, some nurses talking a lot. Yes, you can only speak for yourself, nurse, but I know a number of nurses who are confidential. So I can vouch that for my colleagues, that we are a number of nurses who are confidential. You can trust us. You can come to us for the Pap smear and your business will stay right there in the room where we had the Pap smear done, unless if your results come back and it's abnormal, we would have to speak to either a gynecologist or a medical doctor to give you some medication to help to treat any infection that you have. So we'd have to divulge that information to the doctor or maybe a nurse practitioner like myself, because I too can treat certain infections like yeast infections, bacterial vaginosis, and so forth. So that's the only time you will find that your information will be shared with another healthcare provider, provided that the results are abnormal. But apart from that, once it's normal, the nurse calls you in, or when you get the results, you bring it into your nurse, you sit with your nurse, she explains the results to you, and you ask any questions that you're probably not sure about, and the information stays right there. So do not let fear of the unknown, do not let any of these things be a reason why you don't come for your Pap smear. All right, build a relationship with us. We are here to serve you. We are here to serve you in a professional way. So please come to us. We are waiting for you.
Thank you, nurse. That was very informative, and I hope that every woman, every lady listening out there will heed your call. That was very encouraging. Heed your call to go in, make that appointment, and get the Pap smear done. Thank you so much for all of that information. Ellen, do we have any questions from our listeners?
It's me, phone.
Do we have any questions from our listeners?
I think somebody's trying to ask you on Facebook, Doctor, how you knowing as a man if the pH is unbalanced?
Say again.
I think somebody's trying to ask a question, Doctor, how do you know as a man if the pH is unbalanced?
If the pH is imbalanced?
Yes.
Well, generally, we usually focus on the pH of a woman in terms of the changes inside of her vagina in terms of pH. Because what you find is that the more basic the vaginal fluids are, the higher the risk of her getting infections like yeast infection. But in terms of the man, an imbalanced pH, I wouldn't know exactly how to say that we're checking for a man's pH. I don't know if it's because we can do blood tests to check the pH in the blood and so forth. But in terms of secretions from the penis and all
Right.
of these things, when a man does what you call a sperm count or semen analysis, then these tests would take into account the number of sperm, the pH, and all of these things. So if this person would be interested in knowing about their pH and so forth, they probably would have to maybe do a semen analysis. They would have to ejaculate in a cup
Uh,
and take it to the nearest lab and to be able to determine that.
okay, well, this person has actually been specific by actually saying it's the women pH.
So I did answer the question then.
Right, you did.
All right. So so the pH for the woman, it can be tested in several ways. So when we do a high vaginal swab, not just a pap smear, so we take a swab, all of that is taken into account. We check for the pH of the vagina. So all of that lets you know the risk of the woman getting yeast infection, or if she has an infection as well, it will also, the pH also will be taken into account. Also, urine analysis. When we do a urine analysis, it takes into account the pH of the urine, and urine is supposed to be acidic. So at the end of the day, every woman who is concerned about her pH and all of these things, it's important that she go and do her pap smear, go and do her checkup for her genital areas. And there are some foods that women, is as much as possible, it's important to eat as many, as mainly a lot of foods that will increase the acidity in your vagina, like yogurt. It has the natural lactobacillus inside of it that can help to build your lactobacilli count, and avoid douching, because douching changes the pH of the vagina as well. So all of these things you have to take into account to ensure that you maintain a normal pH to prevent you from getting infections like yeast infection and cervical um, cancer and the HPV virus, being infected with the HPV virus.
Thank you, Nurse. I think we have run out of time.
If we run out of time, I just want to just invite our persons in the region to go to your nearest health center on the various days. So at Soufriere Hospital, Primary Health Care, you can go on a Wednesday to have your pap smear done. At the Delse Health Center, you can go on a Thursday. At the Montgouge Health Center, you can go on a Wednesday. At the Lafargue Health Center on a Wednesday as well. And the Foncé Jacques Health Center is having a big campaign on the 25th of January. I don't want to forget that. Then this will be make sure I let the people know that she will be waiting for them on the 25th of January. She's having a big pap smear campaign. Come one, come all. You cannot afford to miss it. This is the day when you will be able to meet if you're a nurse. For those of you who do not know you're a nurse, for those of you who have been meaning to go for a pap smear, but you have not had the time, make a date on the 25th of January. We're having a big pap smear campaign. I will be there. Ms. Duncan will be there as well. So if you have any infection like yeast infection, you have any infection like bacterial vaginosis, I will be right there to serve you, to give you to treat you, give you a prescription so that you can get treatment for that, for these particular infections. So if you want to know who Ms. Duncan is, she's a beautiful young lady who will be waiting for you on the 25th of January at the Foncé Jacques Health Center. Also, our diabetics, your clinics are usually on a Monday. Every Monday for the month of January, we will be having pap smears to be done for you. So when you come on the Monday for your clinic, book with your nurse. If you cannot do it the day you come, you can do it the following Monday. So diabetics, I'm encouraging you to go to your nearest healthcare provider every Monday, or even during the week. You can book any time that you can go. The nurse will not turn you away. If it is that you cannot go the Monday, you can go the Tuesday, she will still do it for you. So just go or call, make an appointment. If your nurse, ask her when it is best for you to come for your pap smear. So please, please let January be the month that you fulfill your New Year's resolution to have your Pap Smear done at the beginning of the year. So by December, you should be enjoying your Christmas.
Thank
Thank you
you.
very much.
So, nurse, with regard to the diabetic clients, is it only for Saint-Jacques or is it throughout the region, Canaries down to Choiseul?
Well, I can speak from Soufre down to Choiseul, down to Lafargue. I'm not sure, but I know that this month is Cancer Awareness Month for every health center in St. Lucia or everybody in St. Lucia. So I'm assuming that Canaries also would be having their Pap smears campaign as well. I am not sure exactly what date might be, but I think once you call the health center, then this will be able to give you that information. But I know for sure that the diabetics at Soufre, you have your clinics on a Friday, you have your clinics on a Monday. You can go and have your pap smears done on that day as well. Fosse Jacques, Lafargue on a Monday, Montbouge diabetics on a Monday when you go for your clinic, Delse on a Wednesday when you go for your clinic. I actually have an appointment with the folks over at Delse on Wednesday coming. We are having our pap smears to be done. So please, 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 diabetics, wherever you are, whichever community you live in, call your health center, find out when can you come, what's the best day for you to come. It's important because you are at very high risk for getting changes in your cervix. So please have your pap smears done.
Thank you, nurse. Louisa, do we have any notices?
Nurse did a very good job at providing the information. The other thing is we just want persons to remain mindful of our vaccine, our COVID-19 vaccine at Super Hospital today and on Friday. So persons who are interested in coming for their vaccines, feel free to do so. And at our wellness centers, call to say when you are available because different wellness centers offer the vaccine at various dates. And so if you are interested in getting the vaccine at a health center near you, call so that they can put on your name and then you can come in for your vaccine. Let me just say I am very glad that nurse spoke about the wellness centers, about the nurses, and to build public confidence among our population out there, especially when it comes to pap smears, because you hear the concerns when you encourage persons to come for the not vaccine,
The
sorry,
pap smears.
for the pap smear because they are in the same community and they feel they don't have a level of privacy. And I'm glad nurse mentioned that. Rest assured that our nurses are very professional and they will keep everything in strict confidence. So again, we're encouraging persons to come in our wellness centers for your pap smears.
Yes.
Anything you want to highlight, Fawn?
Fun.
No, I think that's it for us. Nurse, thank you so much again. It's always a pleasure having you. You're always so willing to participate and to share your wealth of knowledge on whatever topic it is that we think would be necessary at the time. So I am hoping that the people of Soufre and Choiseul will keep you very busy this month coming in for their pap
I'm
smears.
waiting. I'm waiting. I'm waiting. Thank you so much for having me. It's always my pleasure to be here with you guys and to share with our public what we have available for them and that they can trust us to come to us at any time. And anybody who goes to the health center, you can book an appointment with me as well. So the nurses will let me know what day you want to see me as your nurse practitioner. Any concerns that you have, any questions that you wanted to ask, but you didn't get a chance to ask it. They will let me know when you want to see me, and I can make myself available to be there for you so we can build that rapport and that confidence that we so desire to have with you.
Thank you very much, nurse.
Thank you, nurse.
And thank you to
Thank
our
you.
listeners for joining us today. I hope that you have learned quite a bit about the HPV vaccine and the Pap smear, and you will take on all of that information and make good use of it.
Bye.
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 Bye.